Welcome to the Ask Fabio channel, where today we delve into the topic of erectile dysfunction, ED, in young men. Surprisingly, about 1 in 4 men under 40 seek help for this issue, challenging common perceptions about its causes. While many assume ED in younger men is mostly psychological, some experience severe cases. Treatment often begins with lifestyle changes, followed by medications like Tadalafil, known for its longer-lasting effects in the body. Tadalafil offers flexibility as it can be taken before sex or daily. This daily use can help young men regain confidence and a satisfying sex life without the need to plan sexual activity meticulously. A recent study explored how common it is for young men to recover erectile function after using Tadalafil daily. Researchers aim to identify factors influencing recovery, providing valuable insights into this treatment approach. The study involved 125 men under 50, all new to Tadalafil treatment. Researchers collected detailed medical histories, lifestyle habits, and health factors, monitoring erectile function over time through questionnaires and blood flow tests. After 3 months and then every 6 months, researchers followed up to see if participants maintained normal erectile function without medication. They compared those who recovered to those who didn't, seeking patterns in health and lifestyle. Out of 96 men with follow-up data, 82 recovered erectile function without medication, while 14 did not. Younger age was a significant factor in successful recovery, while other factors like smoking and testosterone levels showed less impact. This study suggests daily Tadalafil can be an effective short-term treatment for restoring erectile function in young men. However, limitations like small sample size highlight the need for further research in larger, diverse groups. Thank you for watching and stay tuned for the next video.